Hi, my name is Laken Koonce, and I am an RN, a DNP student attending UAMS College of Nursing. This is my Pecha Kucha presentation on changes for Arkansas healthcare, titled Closing the Gap, the Nurse Practitioner Role in Primary Care. The intended audience for this presentation is our Arkansas state government officials and the legislative branch, specifically House Representative Tippy McCullough. She is a member of the Arkansas House of Representatives from the 33rd District in Pulaski County. The state of Arkansas has one of the largest shortages of primary care providers. We ranked 8th in the nation for largest primary care shortage. In Arkansas in 2017, there were 1.2 million Medicaid enrollees and only 2,500 physicians and clinics as Medicaid primary care providers. Arkansas is primarily a rural state, and primary care shortages are most acutely felt in rural areas. 50 of 75 counties are medically underserved. We have the 7th highest percentage of persons in poverty in the nation. Racial and ethnic disparities, as well as geographic barriers, negatively impact healthcare in rural and underserved communities. There are gaps in healthcare access, quality of care, and other barriers to negatively impact care in rural and underserved communities and populations. The demand for healthcare services is rising due to a rapidly increasing number of elderly Arkansans and a general population with a high rate of chronic disease. Currently, APRNs have reduced practice in Arkansas and are required by law to maintain a regulated collaborative practice agreement with the physician for prescriptive authority. This limits the scope of practice for APRNs and prevents APRNs the ability to be recognized as primary care providers of Arkansas residents. Policy changes need to be made in Arkansas so that APRNs are recognized as primary care providers, allowing APRNs to be recognized as the initial healthcare provider, allowing them to perform initial diagnosis, act as a team leader, and provide them with 100% of physician reimbursement for all out-of-pocket expenses. With full practice authority, access to quality care can be greatly expanded by increasing the use of APRNs in primary care. Scope of practice restrictions have undermined the nursing profession's ability to provide and improve both general and advanced care. Scope of practice is determined for reasons not related to ability, education, or training, but to political decisions of the state. Currently, APRN prescriptive authority for Schedule II controlled substances is limited to hydrocodone combination products, opioids, and stimulants under specific requirements. APRNs have prescribed medications in Arkansas for over 20 years and are educationally prepared to prescribe for patients without restrictions. Lack of direct payment and low payment rates create a barrier to care. Currently, the degree to which Medicare and Medicaid programs reimburse APRNs directly for services is reduced. To realize the benefits of removing scope of practice restrictions, state and federal programs need to reimburse APRNs 100% independently for their services. APRNs should be granted global signature authority as they often serve as de facto primary care providers for patients. However, the physician must sign any paperwork. This imposes an unnecessary burden on the patient. Involving a physician just for signature does not improve safety, but does add expense to care delivery, delay of care, and additional workload for collaborative physicians. Certified nurse practitioners, or CNPs, have clinical expertise in diagnosing and treating health conditions with an added emphasis on disease prevention. In Arkansas, there are over 4,000 APRNs. Of those, 3,009 are CNPs. Approximately 80% of these CNPs are certified in primary care, and 29% live in rural counties. APRNs are nurses with advanced education, training, and clinical experience with at least a master's or doctorate degree beyond their BSN education and RN practice experience of at least 1 year. All APRNs are required to complete a minimum 500 hours of precepted clinical practicum in their area of specialization with a physician or APRN. All certified nurse practitioners are required to sit for and pass a national certification exam in their area of specialization and patient population. This is to ensure mastery of specialty content. All APRNs must be nationally certified to obtain a license to practice as an APRN in the state of Arkansas. Social determinants of health include food security, employment, transportation, housing, education, and other social conditions that influence well-being. Prioritizing these underlying issues creates a way to control healthcare costs and increase public health. 53% of MPs are more likely to routinely address health equity with patients compared to 40% for physicians. Rural residents are 5 times more likely to suffer from the lack of access to a quality healthcare provider. If regulatory and statutory barriers to utilization as primary care providers were removed, APRNs would have the potential and opportunity to create new access points to a quality healthcare provider for the patients and residents throughout the state. Improving access to care in rural areas and other areas of healthcare provider shortage provides APRNs the opportunity to augment the healthcare workforce and reduce delay of care. APRNs focus on coordination of care, creating a more effective delivery model that reduces healthcare costs and improves patient satisfaction by decreasing duplication of services. Over 40 years of patient outcomes and clinical research demonstrates that APRNs consistently provide high quality and safe care, leading to improved patient outcomes and decrease in chronic disease burden. By closing the gap and increasing our accesses to care, we improve the health equity of our state of Arkansas. Economic analysis supports APRN full practice authority. In underserved areas, residents will have access to services that were otherwise unavailable. Well-served areas have seen lower prices with any level of demand, thus lowering healthcare costs. APRN-led care has demonstrated significant savings, less costly interventions, decreased emergency visits, and fewer hospitalizations. Arkansas is ranked very low in terms of overall health. We are ranked 48th out of 50 states. APRNs have the potential to create new access points and improve the health of Arkansas residents. The largest benefit of recognizing nurse practitioners as primary care providers is the increase in quality care provided that will ultimately improve the health of our state.